Good afternoon and thank you for joining us today on the program Healthy Living. I'm Adesu Walsawagie. Today we're going to be looking at stroke. Causes, why do people have stroke? Can anything be done about it? What are the signs and symptoms? What are the things you should look out for? These are many more we're going to be doing today on the program. And joining me is Dr. Jolly Musa Iguma. He's from Jonos Medical Center here in Benin City, and he's going to be talking to us on this topic. A pleasure to have you join us today.
Thank you.
Dr.
Good afternoon.
Jolly.
Good afternoon.
Yes. When we talk about stroke, exactly what are we looking at now medically?
Yes. Stroke is actually an old name, and another name for it is apoplexy. Medically speaking,
Apoplexy.
Medically speaking, stroke is referred to as cerebrovascular accident. It therefore means that when somebody is tagged to having a stroke, there's an injury to the brain. And by definition, we say that stroke is an onset or an episode of focal brain dysfunction, usually as a result of hypoperfusion of the brain or bleeding within the brain parenchyma. What it means is that when we say there is a stroke, or for a stroke to be established, it means that there's an insult to the brain. It's the brain that is actually involved. And I let you know that the brain is one of the most sensitive parts of the human body. And the brain is 3% of the total body weight, and the brain consumes 25% of the total cardiac output and 20% of the oxygen required by the human body. That is to say that when the brain suffers oxygen for 10 to 15 minutes or more, it tends to lose function. And the main function of blood is to supply nutrients and oxygen. Therefore, if at any point in time that the brain does not get enough nutrients or oxygen, maybe as a result of blockage of supply of blood to the brain, the person can suffer a stroke. Not only that, if at any point in time the blood vessels to the brain, which are concised, if there is a spill of blood within the brain parenchyma, other than the normal channel is supposed to go through, the person can also suffer a stroke. So that can actually put us into the type of stroke that we have medically, because you can see while I gave the definition of stroke, I said stroke can occur when there is a loss of oxygen or nutrients to the parenchyma, or there can also be a spill of blood within the brain parenchyma. In that case, we can say that there are two types of stroke. We have what we call the ischemic stroke, or also have what we call the hemorrhagic stroke. For the ischemic, yes, the ischemic is actually the commonest type of stroke. And I let you know that before we talk about the type of stroke, that stroke is actually very common in our environment. But most often than not, in this part of the world where we are, the cases are not reported. And I let you know that in developed nations where data are kept, stroke has been reported as the third commonest cause of death after cancer and ischemic heart disease. But in our environment, what do we see? If somebody has those symptoms of stroke, and if somebody has an established stroke, medically speaking, but in this our environment, we will ascribe it to be caused by benevolent spirit. Maybe the person in question has committed one offense or the other. So such case might not be reported, and they might not even give a diagnosis, and such person may just be kept at home until the person dies.
Okay,
believing that it's caused by benevolence or evil spirit.
Before we go to types of stroke, what are the signs and symptoms one should look out for?
Yes. I said that the brain is where the insult is in stroke. And the brain is like the computer ass of the human body, that I'm able to vocalize, I'm able to raise up my hand. There's a part of the brain that is responsible for that. So you see that if the part of the brain where the insult is the one that is responsible for motor movements, the cerebral area, the cerebrum is the largest part of the brain. That is where insults are common when they are stroke. But that is not to say that you can also have insults in any other part of the brain, like the brainstem or the cerebellum. But I'm trying to say that when the motor area of the brain, that is the area 4 and 6, all these are Brodmann area. If within that area there is a bleeding in that area, or there is a short of blood supply in that area, the person can have what we call loss of movement.
What will cause bleeding in the head, in the brain rather? What will cause the blood to spill into the brain?
The commonest cause of stroke in our environment is hypertension. The commonest cause of stroke worldwide, the commonest cause of stroke in Igosa, the commonest cause of stroke in the Uri village where I'm from is hypertension. So you see that when you are able to control hypertension, you are preventing stroke. Most often than not, stroke is not a primary disease condition. It's secondary.
Something more.
Exactly. So that is why we have what we call the modifiable and the non-modifiable risk factor. There are some persons that are bound to having stroke as compared to the general group. And talking about the symptoms, as I've told you, the muscle weakness, that is if it occurs in that area of the brain that controls, movement. That is, I said something about the area 4 and 6. And not only that, it can also affect speech. Somebody can have what you call slow speech, is unable to repeat words after you, or the person might even lose speech completely, aphasia, if it occurs in what we call the broker speech area, what we call the area 44. But to be precise, the symptoms of stroke include weakness of the face, we can have weakness of the arm, we can have weakness of the leg, usually in one part of the body. I tell you that the brain is divided.
Just one part.
Yes, the brain is divided into two. We have the right hemisphere and we have the left hemisphere. If there's an injury on the right part of the brain, the part of the body that will manifest weakness is the contralateral side. That is, if the right part of the brain is affected, the person will come down with weakness on the left part of the body.
Oh.
And if there's an insult or an injury on the right part of the brain, maybe there is a loss of blood supply, as I said about the ischemic stroke, or maybe the hemorrhagic, there's a bleeding on the right part, the person will come down with weakness on the left part.
Okay. If you say the brain is divided into two, one would think that divided into equal parts, one part controls one part of the body.
Yes, there's what called pyramidal decussation.
Injury to the right part of the brain affects the left side of a person's body.
The right part of the brain controls the left part of the body. Yes, that's what called pyramidal decussation. So in that case, you see, as a doctor, we have this clinical assessment that this patient comes down with weakness on the right part, maybe an hemiparesis, right hemiparesis. Of course, we will know that since there's a weakness on the right part, the insult is most likely to be on the left part. Side. And insults on the left part of the brain usually come down with speech defect. What am I trying to say? If the person comes down with weakness on the right part of the body, it's the left part of the brain that is affected. Most often than not, such person will have what we call slow speech or aphasia. They are unable to make comprehensive sound because the part of the brain that controls speech is located on the left part. So, other than the speech that is affected, the person may also have paresthesia. That is, they are unable to feel sensations on the affected part of the body, depending on the part of the brain that's affected. Not only that, the person may also lose control of bladder or lose control of, rectal control. They are unable to, have a will over their stooling or urination, as the case may be. Not only that, somebody that has stroke can also experience a severe sudden headache.
Okay.
They can also have what they call the monocular blindness. So they might just wake up and see that one of the eyes is blind. These are symptoms of stroke. And so a person might be lucky. There are stroke that comes up after within 24 hours it resolves. In that case, we'll say that this person has what we call the transient ischemic attack. So,
within
however,
24 hours,
yes,
without the person doing anything or seeking medical attention.
Exactly.
How would the person know that?
Okay, maybe somebody just wake up in the morning, or suddenly just see that part of your body is weak.
It's different from having cramps.
It's different from having cramp. Maybe you are unable to, like I'm able to raise my arm equally, but somebody that has a stroke on maybe on the left part of the body,
okay,
you see, is unable to, that affected part, it's usually one part of the body that is affected. So, such person might be unable to carry out this function, but within 24 hours, it will be reversed. In that case, we'll say that this person has what we call the transient ischemic attack. That is not an established stroke yet. Attack. Exactly, transient ischemic attack. And somebody who has had a transient ischemic attack is at risk of developing a stroke. So we'll come back to the risk factor. We'll also talk about transient ischemic attack. People that have an established stroke, they will tell you, most often than not, they will tell you that they once had a weakness.
That's the transient ischemic.
Yes, they once had a weakness on either part of the body, that the left or the right. The something resolved, after which there was an established stroke. And the problem about stroke is that most often than not, even when the person that is affected by stroke is able to survive it, they are left with disability. And most of them will even end up with physiotherapy. They are unable to carry out their routine function as they used to be. Most of them will now need a caregiver to be able to carry out their normal routine function. Some of them will be unable to carry out the work they used to do before. That might be the need for what we call the occupational therapy. They have to be modified to do a new task, because most of them might be unable to carry out what they used to do before. Most of them, they might not be able to work. Maybe somebody that was once a driver is now having maybe weakness on the right part. He might not be able to drive well. Might not be able to, maybe a tailor that is able to use the hand with dexterity to, control his work, might not be able to use the hand very well because of stroke. Yes, exactly. So you can see that stroke is one thing that we have to protect. I mean, we have to, understand and also do away with, because it's something that is preventable, and some of them are also treatable.
Okay, sometimes you hear that people will say that they just woke up, or somebody who was initially ill and healthy will just wake up one morning and discover that one part of the body cannot move again. No sign of any underlying ailment.
Yes, I tell you that in this part of the world where we are, most of us don't even know our health status. Okay. I did say earlier on that stroke is actually a secondary disease. There's usually a risk factor. There are some morbidity, some disease condition that will predispose somebody from developing a stroke. It's possible that this Mrs. A or Mrs. B, who slept the previous night, is not even aware that he or she is hypertensive or diabetic, but slept, woke up and found out that part of the body is paralyzed, is unable to use that part of the body very well. But with clinical assessment or with laboratory investigation, we get to know that this person has an elevated blood pressure, or a diabetes as the case may be, or this person has an underlying heart disease condition that have resulted to this stroke. So you see that if we are able to, for we to protect or for we to prevent our body from developing stroke, we must be able to prevent certain risk factors, though some are not modifiable. Some are fixed. Whether you like it or not, it's just more or less like somebody that is 55 years and above. That is the first risk factor now. Someone that is 55 years and above is most likely going to develop stroke as compared to the general group. I tell you that 2/3 of people after the age of 65 and above develop stroke as reported medically, as compared to people that are less than 40 years. That is age. And for sex, may tend to suffer stroke as compared to the women. But the women die more from stroke as compared to male. Hormonal factors responsible for that.
The male seems to have a higher number of
yes, incidence of.
But the females die more.
More of, like that. So there is nothing one can do about that. That is established, that is not modifiable. Not only that, race. I will tell you that it's common in black than
in white.
For the reason be that the black tend to suffer more from hypertension as compared to white. Hereditary. It's possible that somebody whose parents died of stroke will also develop a stroke. It runs in the family. And they don't call high fibrinogen level. There are some persons that have this high level of clotting factor.
Okay.
And for somebody to have an ischemic form of stroke, something is responsible. A blood clot, you see, blood is supposed to be light for the blood to be able to pass through blood vessel.
Okay, Doc, we're going to take a very short break at this point. When we come back, we'll continue, particularly bringing up the risk factor for stroke. We'll take that short break now. We'll be right back. Stay tuned.